My name's Giles Davies. I'm a consultant Oncoplastic Breast Surgeon at the Cromwell Hospital, and I'm also the Director of Breast Surgery and member of the Medical Advisory Board at the hospital too. What we've all found over this coronavirus pandemic is that patients have been experiencing a lot of anxiety, and that anxiety and fear of seeking medical help has led to a very rapid and large decline in the number of patients seeking advice from both their GPs and also through the direct access line to Bupa insurance, with symptoms and signs that may be suggestive of cancer, not just breast cancer, but in fact across all cancer types. I think patients may feel reluctant to seek advice in that they may be fearful of not being able to be assessed, or in some way that they might catch coronavirus on attending an appointment, or in some way that the services will be not available to them. But in fact, the capacity around many hospitals has been there in the background all the time. And we're really strongly encouraging patients to come forward now who've got particular symptoms and signs and get them assessed as quickly as possible. We've been using a platform called Visionaball, which is a very effective video consultation platform, and it's worked really well for our patients. A lot of doctors were a little worried and anxious about the obvious limitations of video consultations with regard to examination of patients. But we found that by communicating visually and in line of sight with patients, it brings a doctor-patient relationship much more formed, and you're able to pick up on the nuances and concerns of the patients in a much more effective way. This has allowed me, in a sense, to triage the patients who need urgent assessment and bring them in quickly and have tests that have led to their diagnosis of breast cancer at an early stage. And as we know, early diagnosis is the key with any cancer speciality, and the Visionaball platform we've had has worked really well for delivering that care to our patients. At the Bupa Cromwell Hospital, our priority is, as with any healthcare institution, around safety. And not only the safety of our patients, but the safety of our staff. And what we've done in preparation for the lockdown, and in fact a feature of our everyday practice, is that we are triaging patients. We are testing patients who are admitted to the hospital for planned surgery at this point in time with coronavirus testing to make sure that the patients we have on site are negative for the virus. We're offering very liberal testing to our staff so that they can remain safe and be tested quickly if they have symptoms. We have a very effective communication pathways between all teams and departments, which allow us to quite seamlessly categorise patients according to their urgency and need of care. We've adopted a policy to temperature check patients when they arrive at the hospital, and we've got very clear signage on social distancing, and the staff are dressed down a little bit from their usual attire. You'll see many of them in scrubs around the hospital, and some of them are wearing masks where appropriate. And we're protecting our staff and our patients, and the patient feedback we've had from patients coming who've needed tests has been a very positive one. And I did have a patient who felt she was more anxious about going around her local Sainsbury's than she was coming in and having her assessment and subsequent breast biopsy at the Cromwell.